space, what will about the troubles, what it is to be treated?
We tried to change the space in my jaw. And it's really improved a great deal.
It's improved a great deal, you heard? Yeah.
The change is tremendous, the difference between having the space and not having the space.
Yeah, good.
And
Headache?
the headache is really corrected.
The headache is corrected, fine.
Yeah, the vertical dimension was opened up about an inch over a period of time.
Shoulder?
Yeah.
Okay.
Yeah.
Right side, left side?
Right side.
Which movement is painful, or you can move it?
Yeah, I can
Nothing.
now.
You can move it here? Doesn't hurt?
No.
No, no more. Nothing. Is your pain?
Okay.
Here.
Right there.
This is a painful area I talk to you. Oh, fine. More on the right side. Not necessarily that the patient takes off his clothes, or you can feel it. It's so painful. Also, so such a sweater here. Okay. You can feel here this area.
Tight. That was it.
Later on, I'd like to have this light, if it's possible, this light of the Adler points. Later on. Yes, this? It's called open light. Does it? Okay. I sent you the Adler points in English.
Okay, good.
And you have the rest of the book if you get the Adler points. You have seen that. But you have the book. In the book you will find it. Please give me the next the name of the book and where to get it. I would recommend that you all might have the Adler book. It's a wonderful book. Oh yeah. Painful. Here it's painful in the lower jaw, the area of the egg. Here it's most. Now here, not so much. Okay.
So we remove the tension?
Not on the left side. You see the difference again. Now I have the area of the 6th, 7th, 8th. Great premolar again, right side. 6, 7, 8, here it is. Very painful. I near the bone of the oblique externally. Now it's less. If I come up the ramus mandibulae, no more. It's more in the lower jaw here. Now, maybe take over the wait a minute, dentist. Right?
Yeah, sure.
Fine. Okay. Now we can throw it into the other jaw. Here. Painful. The tonsils. So we have 3 special points: lower jaw, right side, upper jaw, wisdom tooth, premolar, space again. Fine. And these points we will have another check now. If they are painful, right side or left side. Right side. Left side. I give it a heart pressure, you feel? But this point is very pretty. Here. Yeah. And here. You see this? You see the scar? And the scar passes the midline again. Here. I've seen that so many problems, energy problems, are caused by scars that pass the midline. These old men, they very often, excuse me, I thought about you, I thought about old men. Old men very often have a scar here from furunculus, carbuncle as we call it. And the skin here is hard like wood. If you give injection in the scar, it's like wood. Or they have a very shock throat here. But it's like a scar in these cases. And if you inject it, they have so much better energy in their head. They are so much better in their thinking and everything. It's like if you would give them any remedy for the cerebral circulations. a better working. So we have this scar to be controlled here. You have more scars, I think? No.
I have one scar that crosses here.
This scar crosses again the midline. Think of it, scar here and scar here. So both midline meridians are blocked. So the energy here to this area can be, in a way, blocked too. Not necessarily, but it can. For I often get questions from doctors, for example, ENT doctors. We have operations at the auricle, cosmetic operations, that we have scars here or there, or if the auricle is outstanding, and we have corrections to put it here in this position. So there are scars for a part of the auricle is removed, of the perichondrium, we take off. And so we have lots of scars. And they ask me, what is this for the acupoints? For the ears, they're full of acupoints. But we have seen it doesn't matter so much. It can, but it's not necessarily matter so much. But the midline meridian, this had to be treated, I think.
You want to do this one?
So we have the little testing, and you will receive it, right? Again, we have the scar. We can inject all the scar immediately, or we have the test first if it's sensitive in the area of the scar. No? No feeling. Fine. And I not only have my dabbing along the scar, but a little outside of the scar. For if you have a suture, then sewing, they are not only the scar, but outside on each side, again, they are very small scars. But I think it's very little. Nothing special. No? Here's the side.
I've treated it in the past.
Wonderful. It's nothing. Thanks. So we need not do it. So we will look at this area here. It's a technique of the neurotherapy, but it's interesting that it...
Turn the chair so it'll be easy for everyone to see.
That the Japanese acupuncturists, they have described two special acupoints for dentistry. For pain in the upper jaw, they use this point, I will demonstrate now, with acupuncture needles they do, no injection. And for the pain in the lower jaw, they have described the point situated here, and they have long needles. They stick it along this direction in the lower jaw, and in the upper jaw in the same direction as I will demonstrate now. First we again control the point where it is. Here it is. Okay? You see it? Yeah. Yeah. You're good. Okay. The needle drops again. Now first I have a little bubble at the surface of the skin and wait a moment. Okay, that's all. Fine? Pretty steep. Relax. So now you see.
Are you still injecting?
It has saline or
0.5% xylophone.
Fine. Pretty steep. Do you feel that? Where do you feel it?
A little dizzy.
Easy. Okay, no more. But you can imagine the direction of the needle, and it again comes in the same area which we can get by the retromolar space. Maybe? Fine? Does it hurt?
No.
Very little. If you have such fine needles, it doesn't hurt.
Is that an acupuncture point on the stomach meridian?
Is it an acupuncture point?
On the stomach.
No, not precisely in the stomach meridian. It is one of out of the meridians. But the Japanese have described this point especially for dentistry, and if you have severe pain in the upper jaw, you can also use this point. And I've demonstrated you if the needle goes in deeper, it doesn't matter. Okay? Will it down again?
Maybe, yeah.
Good. It's a point to be happy, is it?
Yeah.
Good.
Yeah, I feel fine.
She feels fine.
How far did you enter the needle?
It depends on. You have seen I had no pressure on the needles. I did not drive the needle in, but the needle nearly dropped it. You have seen? And as long as it does, it's no problem. It wouldn't hurt the bone or anything because it's on the back side of the zygomaticus. And if you look at the skull, there's really nothing. There are some blood vessels, but the risk is nothing. And you go with a needle in this space again. Again? Can you see? So you come again to the retromolar space. You
really on top of my posture.
I think the needle was in this edge, was it? I think I had this position of the needle. You see? But you as dentist, I would suggest do it from inside. Is it? Dr. Diamond would prefer do it outside. Good. As you like, it's both the same. You come to the same space. But for a dentist, maybe better inside. For a medical doctor, better from outside. Whatever.
Yes. The question is the xylocaine, can you buy it at 0.5%? Yes, you can. In bulk. Those are already diluted at 0.5%.
And now the point, you remember, it was very painful. The point is gone.
Okay.
Does this, you remember? I had the patient before in the retromolar space system, two spaces gone. And there was a pain in the lower jaw, you remember, right side? It's still there. It's still there. That had to be treated. Be good.
Are you going to treat that extra orally? Are you going to treat that extra orally?
You can. It's the same again as the Japanese do with a longer needle. If I stick in this needle, have a look. Where my finger is situated for this pain. Give me signal if I have this area where it's painful. Here it is? Here it is. Now I feel here. You will feel my finger. Come here. Come here. You will take up and outside. Try to get my finger. Yeah. See? Here's my finger. And if I would give the injection here, in this direction, I would proceed come to the same area. Is it? Japanese do it in this way, but we are dentists, we do it inside. Okay? Oh, yeah. I will give you a little more place to see. Do you feel any special point here? No, don't feel. Sometimes no mimical reaction, it was nothing here. But the needle was so typical.
Yes.
It is? Only some drops, I think it might not have too much. Okay? And she might lie down. Okay? Thanks. Fine.
Thank you.
Okay, we have another.
Thanks. Good. Questions to this technique? Questions?
Was there any effect on her arm? She had a shoulder.
The shoulder, but
Is there any?
She had a lot of motion.
we have treated the retromolar space by the outer needle. And so it's the same as if we would have done inside. But she had no pain when moving now. Dr. Diamond may have treated before, so it's not so good to demonstrate. Yeah?
When you have a sensitive part of the chest, do you have to inject in?
Yeah. She had the painful area here. You give me so many good helps when I forget something. For she had the very painful point here. Is it gone?
It's much better.
You see? Thanks for your idea. Yes.
Shoulders better too.
Shoulders better too. But she was so painful. You remember? When I had the first palpation here, I have very hard palpation. It's gone. And so many patients, if you do your treatment within the mouth, and you come to the retromolar space, many of the lymphatic problems are gone. When I had a workshop in Austria, in Salzburg, you know, at Salzburg, there was an Austrian doctor, and when we talked about this retromolar space in the upper jaws, he said, you know, Gleditsch, what you do, there's a lymph pump. What is it, pump? Pump. It's a lymph pump. He called it a lymph pump. I can't say if it's reality or not, but something is in it. It's a point to get the lymphatic and the immune system. Oh, doesn't it?
Your experience, what do you find in terms of necessary to repeat, Mr. John?
Hello.
This is Jennifer, and we have to thank Jennifer for lunch because
Oh, this was a very good lunch. Was it? We have to
Jennifer
take
found
away.
out that
Very good.
cooking health food is the best, the thing that made her feel best. So she made a business out of it.
I have not yet finished. I have a little in my pocket. When I sit in the plane, I will eat the rest. It was so good, and then I have more time. So look, what's the problem? What pain? Some special to be treated? You have some pain or problem? No.
Yes.
What is it?
Well, I was telling Benny I hadn't been wearing my appliance lately, so sometimes I have some pain.
Pain.
Up here. Yesterday I found the right place for my jaw when my teeth weren't coming together, but it stopped the pain.
Stop.
Yeah.
Good. Again, we have the control of the midline point. Okay. Little here, but very little. Again, these points you remember. Subclavicular, right and left side. Here's the left side. Here it is. Not too much. Midline points in the jugulum area and points on the sternoclavicular joint. Control of the cervical spine, okay. Nothing. And you don't forget the yaw angle points. Nothing, okay. So we control inside. I hope there are some fingers left.
Is there any more finger?
Fine. I use more than I expected. Painful here? Where's your headache if you get this tension?
It's usually here.
Left side? Right. In acupuncture, for some of you are very good trained in acupuncture, I think, you have patients with headache. You can divide the head in three different parts. The facial part, the lateral part, and the dorsal part. Pain in the facial part is connected with the meridians of the front side, especially of the stomach meridian, large intestine meridian, and lung meridian, which is connected, so that we can say a problem on the front side in many cases is correlated to the digestive system, in many cases. And we know, as we mentioned before, that our system of teeth and lips and oropharynx is connected with the element or with the functional circuit of spleen, pancreas, stomach. And the sinuses, all sinuses, are in a special way connected with the lung meridians and large intestine meridians. So again, all what is here on the facial side, stomach, spleen, and large intestine, lung. What is situated laterally, in most cases, is correlated to liver gallbladder. Liver gallbladder, that is all which is connected with movement and turning. All problems with turnings. Not only turning the head, also other joints, hip joints, all movements inverting and turning, they are correlated with liver and gallbladder. So we have to think of when we have a lateral headache, migraine for example. And moreover, we know that the meridian of the gallbladder is connected with the triple heater. The triple heater, if we would mention it, begins at the fourth finger. The triple heater runs to the face, comes to this place, and then goes on as named as gallbladder meridian and goes down to the fourth tube. So that we have a connection from the fourth finger running and named as triple heater in the upper part and running again to the fourth tube named gallbladder. But it's one line. It's one line. Caught in the upper part, triple heater, caught in the lower part, gallbladder. And the same, we have this other line, the line of the index finger. The line of the index finger is caught in the upper part, large intestine. Again, running here to the nasolabial fold, and now another name is now stomach meridian, going down to the second tube, the same place again. So we have these vertical lines we talked about in the beginning, only to mention it, very short. And if we have a trouble, for example in lateral headache, we can treat it either by gallbladder, liver, or by triple heater. And many of these headaches here, I treat with my patients with points on the fourth tube, especially in this area. You see, painful? Here it is. This is this area. This is a distant point for this migraine or lateral headache problems. Yeah. Gallbladder 41 for the acupuncturist. You see? She began to breathe deeply. Well, it hurts. It hurts here too. This is the liver between second and first tube, and between the last, the fifth and the fourth, it's a space for the gallbladder. It begins, you see, it's a very typical reaction. So we know there may be a problem in the lateral side, and as we have learned by kinesiology and by Dr. Volk's machine, that all what is correlated with the fourth finger, he called it in acupuncture, in classical acupuncture, triple heater. In modern terminology is the endocrinium. It's endocrinium we can test by kinesiology, we can test by Dr. Volk, so maybe that there's a little trouble with the endocrine system. We can have it controlled inside the mouth. Triple heater area not painful. And here the area of the ear. There's a special area of the ear, the deepest point of the concha. You see here this arcus. This is a hormonal zone of the ear. Sometimes I only touch it in this way, you see? I go over the ridge here, over the rim. This is the endocrine area, the several endocrine points. But there's no reaction. So I think the best we have treated is this area here. Look. Point for you?
Gallbladder.
Gallbladder. Here's gallbladder.
Always gallbladder.
Gallbladder, there. So, I think it's best on the outside. Left side, right side. There's more pain. Is there a difference between left and right? Left is more. If it would be painful in the area between, you remember, between upper jaw and lower jaw, inside, I would not treat inside the mouth. But it's very little, and so it's better to have the treatment be done here. It's the same technique as we have used before. Right. Good. Again, the patient first. Thinking. Here it is. Since the needle drops, there's a little bubble again. Breathe deeply. Fine. Yes. Did it hurt?
Mm-mm.
It looks much more dangerous than it is.
Okay.
Is that a 7-8? Is that a 7-8?
7-8. Yeah. Good.
Okay.
Fine. But can she lie for 10
Yes.
minutes? Fine. Goodbye. Thanks.
Thanks.
Okay, we have
Sandwich for the plane.
one more that we're going to try to squeeze in before 3:30.
Can I just say something? When I was in Munich with you,
Yeah.
we found that the energy on kinesiological testing of the patient was always highest when an external procedure was done as well. It seemed to add
Same.
another level.
Yeah. It is really something special in this area. This area, backside of the zygomaticus, this area of the retromolar space of the upper jaw, the area near the temporomandibular joint. You don't know what it is, but it is an energetic centrum in the body, and as well in psychology. Now we had treated the day before yesterday, was it? Yeah. When I write the evening. Yeah.
Yes,
I
we
remember.
won.
Yeah. And how do you feel today? It was very painful, I remember here, it's this area. There's a question how often we can repeat such treatments, for example. I have treated this point and you see it's again very painful. It was one of the painfulest patients I have had in this area for a long time. But as this patient stays in the house of Dr. Diamond, I would suggest to treat it 2-3 days later. To wait for some more days and not have another treatment here today. But before you leave here, it might be okay. It's very important. At this point, does no more hurt. Maybe after 2, after 3, after 4 treatment, I can't say. But have a try. How's with you?
Good.
Yeah? Here it is. Had not been treated, so we can treat this point. Was there some problem with the thyroid? No.
With what?
With the thyroid? Thyroid? No.
This is
It's very painful.
my mother-in-law. The problem started 25 years ago when she had a dental extraction. And she has the classical syndrome described in Magoon's book on cranial osteopathy, that the whole skull is just sort of twisted sideways, and the problems have defeated every dentist and son-in-law since.
Wait, how many years have you been married?
Good question.
Without the facts.
Do you begin with this point? This point is very painful. It was not treated.
So these are developing, so I wanted to see if these points were developing.
Yeah. Yeah. And we have learned that this point is very much involved in all lymphatic and all other situations of the jaws and the sinuses. So it began after the tooth treatment, maybe that we have to treat this point. It's again a sensitive area here, and I have a palpation within the mouth. Please begin to palpate on Monday with your patients. Also, if you do not treatment, that you get the feeling in your fingers, and that you learn to differentiate more right side, more left side, more upper jaw, and that you learn how much pressure you have to use. For I've seen with my colleagues in Germany and Switzerland that they normally begin with too little pressure. They are too gentle with their patients. Think of it, you can pressure hard, but you have to be very careful when injecting. This is one of my very hard impacts in it. Here again you see it's the area between. You know what I mean is between. It's no more the lower jaw, it's no more the upper jaw, it's the between area on the ascending mandibular. There's a very sensitive area on the right, not on the left. Here it is the area of the canine premolar. Here again, more in the upper jaw. Here it is, thank you. The upper jaw we treated last time was better. Left side, I think here at this point. Now we have control in this ear point area. First and what? Left side more, right side? Both. Okay. So we will use this one. Is it? Is that 45? The midline, breathe deeply. A little bubble and control again. It's a very little bubble. Here. It's deeper. I think it's not the right point, not yet. So we have another try here. Oh yeah, here. See? Since the reaction of the patient, and same moment the needle, yeah, fall into point. You can have the needle sitting as an acupuncture needle. Now we control inside. It hurts very much. So is a typical change. First treatment, there were other points. Second treatment, more uverum area, more the line between. No more so much retromolar space in the upper jaw. And the reaction here in this point, they're a little too late. Maybe you treated? Fine. And first, please deeply. Let's enter. Here. And again, you see? It's having movement. If you wait, what happens? See what happens. Anything? Okay. Massage. Can you? Good? Little? Right? Okay. Okay.
And better, so you can
It's
just
better?
shift sometimes.
It seems to shift and move.
Okay. Here you go. Same area on the left side. I have a problem. I can't work with my left hand. I hope some of you are both hand. It's much better. Isn't it?
There we go.
No, that's best. That's best. Wonderful. Fine. Again, a little massage. Did it hurt? If you ask patients, they say nearly nothing, is it? It's a fine that patients are laughing after treatment. Same as the girl did. Good. Fine. Let's go. Fine. Okay. The vertex point. Painful here. Here. I give a little point here for the acupuncturist in the midline or near the midline. It's again, yeah. And we can have a look at, oh yeah, it helps it again. That's right. We have not such needles, such rings in Germany to screw with. No plastic, no one use. And I think it's very good, for we have to fix it very hard. And if I demonstrate for our colleagues in Germany, I have to say they have to fix it as hard as possible, that never the needle can be lost. Here we have not this problem, but there's a problem to get it lost when it isn't the point. Is it? But there's a little injection so we can put it again without pain. So fine. Good. Fine.
That was quicker.
Yes, that was quicker. That was much better, wasn't it? No, that's okay. Not too much today. Fine.
The point of the sternum again, the lower point on the sternum, is that
Yep.
where it was sore before at the beginning?
Yep.
Is that still sore?
The lower point. Thanks for the question.
Overnight.
You think of this point here?
Yes, that was sore at the beginning.
It's still there. It's still there. I treated, when was it?
Yes, 2 days.
2 days ago.
2 days ago. And therefore I will not treat this point today. The mother-in-law of Dr. Diamond stays here for some more days, and I would suggest that she get treatment at this point, maybe next week, Monday, Tuesday, no before. I think it's good we talk about that the treatment has not to be repeated too often. Not often is the same space. If you have a patient treated on Monday in the upper jaw and he has problems and comes again, take next day or Wednesday, Tuesday, Thursday, the lower jaw, or take here some points, but don't repeat the same point within 1 week. It's my experience. 5 days may be possible, Monday, Friday, but better to wait some days. Thanks. Best wishes.
You don't even need the needle of the...
10 minutes. Okay? 10 minutes.
Oh,
10 minutes.
excuse me.
Be careful.
Uh-huh.
Some more patients?
No.
No, right. With glasses. No more glasses now.
Very good.
I have a patient who has a...
Okay. We have time for just a few short questions because we do have to catch a plane.
I'm so sorry that we have such problems today. I would have been here
warmed
after
up.
6 o'clock.
Then we go.
But you are so cordially invited if you come to Europe and you pass Munich. Call me, come and practice, and we can stay a day together. You can look at my practice, and we will have it nice in Germany. And I am so sure that you will have some meetings here with Dr. Green, and that you will exchange your experiences. But now we have time for some more patients.
I have a patient that is recently in the hospital, and she has bad eyes, and she's had problems with her eyes. And recently she had a fall, and you have your nose, they did a tremendous scar across the midline.
She had a scar here,
Yes.
treated. We had a patient yesterday with a scar here. It's a very important area. We have learned that first it's midline, and everything which is here, the Chinese called this area point de merveille. That means a wonder point. Wonder point, yes. It's the point which can give wonderful results. And it's a special point also in thermography, because it's the only point that is constant in temperature. We don't know why. It's a special point in the skin. And if there is a trouble, I would treat it very carefully, but I would
Would you
treat it.
inject into the scar?
Yes, you can do.
As we saw here,
Yeah?
with Monica across the top,
Yeah.
using the
Yeah.
xylocaine, using the dabbing technique
Yeah.
to find the sensitive points, and going around and also around the scar.
Good.
We come to recognize that there are no systems in the body that are there by mistake. The question has always been about yawning, fatigue and yawning, and was it squeezing the thyroid gland? But perhaps the stimulation of this area that you've just pointed out with lymphatic drainage.
It's so good, this question. I will explain what is my idea. Go in a zoo, and watch what the animal do. They do it lots of time, open the mouth, close again, open, close again. First I said, oh, they are stupid. My first idea was stupid. Why do they do? But I'm sure animals know what is necessary to overcome their tension. To be in a zoo, that gives lots of tension to animal. I don't believe that animal in nature, out in nature, that you would do it so often as in the zoo. But if you are imprisoned in a zoo and you are full of tension, the animal knows how to react it. It does it by this way, by yawning. Yawning is a wonderful way to overcome your tension in the temporomandibular region. I'm sure that you had a very good idea, isn't it? Another question?
Yes. To what extent could the toxic things that are in the mouth, such as the interest that a lot of us have about the mercury, affect those various areas that are so close?
You give me a very good idea. Thanks for we didn't talk about. We have talked about all these points and which can be painful and pressure. We have learned that these points are no more painful and pressure if the patient, for example, had got an X-ray treatment, maybe for cancer, maybe for rheumatoid arthritis. If they had a series of radiations, the points disappear for some weeks or for some months. That means the regulating system no more works. It has diminished in a high degree. And the same result is with lots of energetics, lots of psychopharmaca, these tranquilizers. The same result is with corticoids. Think of it if I treat asthma patients who have got corticoids for a longer period of time. I don't treat them. I talk with the doctor when we can diminish that they have a very low dose or no more corticoid tablets. And then I begin my acupuncture treatment. For the regulation system of the organism is blocked as long as we have a higher dose of corticoids too. So we have to realize that there are many kinds of blockage. And as we have learned by Dr. Voll and his techniques and other techniques by measurement, our toxification by the environmental conditions more and more give a blockage to our regulation system too. If you don't find points, that doesn't mean that the patient is healthy. Thanks for the question, you will. So very important we learn it. No points is not to being healthy. I have seen that all patients with a very reactive system, allergy is a very reactive system. To have many troubles in the sinuses, to catch a cold here and there, or bronchitis, it's not comfortable for the patient, but it shows us that the regulating system works. We have seen that patients suffering in cancer, and you ask them, they very often say, I haven't been at the cold for 20 years. I don't know why I fall in cancer. And we say, how bad for him. It's so very important that we learn that all kinds we call for katar. Katar? Katar means cleansing. Katar means swimming out toxins. If you have one cold a year, let it go. If you have one sinusitis, don't take antihistaminics. Don't take remedies. Take some plant remedies, but no more. Let it come out because it is a detoxification of your body. We need it sometimes. Our medicine now is
so that every little problem, like a cold, like a flu, is to suppress by tablets, by medicine. It works. But what do? I've seen the sinusitis treatment. If I gave patients for sinusitis treatment antibiotics, chemotherapeutics, the points in the retromolar space still remain painful, nearly less than before. But the patients have no more sinusitis. They have no more symptoms, no more pain, no more running down mucus and such problems. Is that really finished? But what is it about? After 2 or 3 months, there's relapse. What to do? Another antibiotic. What to do? Same treatment or drainage, punctating the sinuses. The ENT doctors in Germany, in all over the world, what do they do? Third time, third relapse, fourth relapse. They say the sinuses have to be operated. I haven't done sinus surgery now in 7 years. Not one case. Only if such cases after dental extractions, if we have an opening. You know, this is mechanical. But by inflammation, I do no more sinus surgery. The only is if there are polyps, polyposis as we call it. There's nothing to be done. Not by acupuncture, not by homeopathy. They have to be operated. But the normal sinus condition can be treated by conservative methods if you combine acupuncture with homeopathy and with change of the nutrition. That's the most important of it. That really the patients finish with sweets. Some have to finish with milk products if there's an allergic component in it, and you will find what it is. You will find out. The patient will be active in his own way. You can say, please let all milk products out for 2-3 weeks, and then begin again with a high dose of milk products. And if it's an allergy of milk products, the patient will feel full of symptoms, and he realizes that his problem is a milk product, so he can manage itself. He's convinced now. But think of it that we have to do it. Some more questions?
Getting back, the specific question was, how does the mercury affect, the mercury vapor affect the area of the acupuncture points, which is so close, especially on the class 5s in the posterior areas?
The mercury effect is very difficult to discuss. We have learned it is a very personal reaction on it. For me, for myself, for example, I have been operated twice in the kidney, as a child and 20 years later once more. And when Dr. Kramer was it, when Dr. Kramer tested me, I was full toxificated by mercury. And when all amalgam filling were out of my body, I had no more troubles with my kidneys. I don't know what my kidney, it only works. After 2 operations, I have no. So really, in my case, I have to say in my case, the amalgam was toxificating my kidney. But it's not for every patient. But we have to realize that it's possible if we are in a high degree sensitive. If one patient is more sensitive, the other less. But our environmental conditions give us all a higher level of sensitivity, increasing from year to year. So that more and more patients now get a sensitivity also against mercury. That might not have been in such a high degree 10 years ago, and not at all 20 years ago. For the discussion about mercury is not only the mercury, it is our kind of reaction, our power, our resistance. Our resistance has diminished. I think that is the most problem we have to discuss. And we can change more. How we can change this environmental conditions? They have no chance.
Okay, that's it for the show. I want to thank everyone for being here. Thank you, Dr. Gleditsch. I think you all got a very nice introduction, and more than that, enough to have a working knowledge of this. To encourage you, if you would like, we could form a meeting in a couple of months, maybe the beginning of June. And in addition, I have some syringes and some needles that you could take a couple of them, you'll have them in your office, and you can start playing.
Yeah, how they say yes.
Betty, Betty. If you are interested, you can give some of I'm sorry that I have to leave so early, but maybe then you can give you a little exchange of your experience.
Thank you so much.
Thanks. I would thank you all for a wonderful auditory. Thanks you all.
Thank you. I have relatives that came from Munich. So in any case, I'll see you.
Fine, good. Thanks you. Thanks. Thanks.
Thank you.
Thank you. I'm sorry that I had not run more 2 hours with you, but maybe that was such a lot of information you had to digest it first.
Yes.
Is it? Thanks.
I'm really enjoying it.
Thanks. Thank you for all your help, your interest. Thanks so much. And if you come to Germany, you're so welcome. Fine. Yes, John. Thanks very much. This is all. You keep it. You keep it. This is all. Only the injection. Take upstairs. Take it upstairs.
3 months, so.
You want to go to the airport?
Let's get upstairs. Right. So thanks.
Unless you have any coffee.